afternoon, everyone, and welcome. Thank you all for taking time today to join us for the first session of 2026 GSNV's Impact Series. My name is Malavika Vasant, and I am the Project and Policy Coordinator at the Genetic Support Network of Victoria. Joining me today is my colleague, Susie Roxo-Farkas, who is a project officer at GSNV. She has an extensive experience working with consumer advisory groups through the LINEAGE-GUaRD project. We are really excited to be kicking off this year's series with a topic that has been increasingly important across the health, research, and community sectors, which is community advisory groups or CAGs. Before we begin, I'll just like to acknowledge again that today's workshop is intended to be interactive. We will be asking you a few questions throughout the session. So please feel free to contribute in any way that you feel comfortable doing so, either in the chat or raising your hand or just by sharing your experience. And again, there are no right or wrong answers. We are all here just to learn from each other. Before we begin, I would like to begin by acknowledging the traditional custodians of the land on which we meet today. The Genetic Support Network of Victoria respectfully acknowledge the Wurundjeri people of the Kulin Nation as the traditional custodians of the land on which we live and work. We honor their enduring connection to land, water, and community, and pay our deepest respect to the elders past and present. We also recognize the strength, wisdom, and leadership of the Aboriginal and Torres Strait Islander people. I'd also like to acknowledge the lived experience community at GSNV. Everything we do is grounded in the knowledge, resilience, and expertise of people living with genetic, undiagnosed, and rare disease condition, along with their families and carers and supporters. Their lived experience continue to shape the work and remind us why meaningful community engagement matters. And finally, just a quick note again, today's session is recorded and the recording will be shared with all of you after the workshop ends. If you have any questions during the presentation, please feel free to pop them up in the chat. We will have a dedicated time at the end of the session for a discussion, but we'll also try to respond through questions as we go through the presentation. Now, I just, quickly want to ask all of you a question on what you think the word community means. I think it'll just, help us understand a feel for everyone in the room. So don't overthink it. The first word that comes to your mind when you hear the word community, feel free to type something in the chat or just, unmute yourself. Let us know, any word that comes through to your mind, the first word that comes through. I'm going to give you all a couple of seconds to, have a think about it and just, mention whatever comes to your mind. All right, we're getting a couple of answers here. Connection, group of people connected via shared interests, solidarity, support, inclusion, people we interact with regularly, oneness. Amazing. We do see a lot of common themes in a couple of these words, if you feel the same way as well. Care and support. Amazing. Understanding. Yes. Okay, these words are really interesting because this is exactly what a consumer advisory group or a CAG essentially are trying to create. It's not simply creating a committee or a community. There are spaces where relationships are built, people feel heard, and their lived experience genuinely shape decisions. I'll I encourage you to keep these words in mind and throughout the session, because we will be coming back to them throughout the session. So, um, just to briefly touch up on what we will be discussing throughout today's session, we will start off by talking a bit about what consumer advisory groups essentially are and why they have become such an important part of community engagement. Then we'll share two examples from GSNV projects while we established our CAGs. Susie will walk us through her experience establishing the LINEAGE-GUaRD community. And then I'll share a bit about my experience establishing the community advisory group for the Mapping the Journey project. We will also honestly share some of the challenges we encountered, some of the things we wished we'd known earlier, and practical tips that you can take away if you are thinking about establishing your own consumer advisory group. And finally, we'll end with a discussion where we'd really love to hear your own experience, thoughts, and ideas about establishing a consumer advisory group. All right, I think the most important question, what exactly is a consumer advisory group? It's a really simple question. So at its core, a community advisory group, also known as a consumer advisory group or a CAG, is a group of people with lived experience and community expertise who work alongside the organization to shape projects, research, and services. Now, the word alongside is really important because you're not exactly consulting with the group, you are involving them throughout the process. Now, this definition might seem pretty straightforward, but I think what's the most important part is understanding that what makes a consumer advisory group different from just regular consultations. Many organizations consult communities. They might either send out a survey, run a focus group, or ask people to review document once it's already been written. Those approaches certainly have value, but once community advisory groups actually take this one step further. So I think essentially, instead of asking the community, what do you think about this? We are asking them, how do we design this together? It's a very subtle shift, but it's a really important one as well. So rather than asking people to comment on decisions that's already been made, we are inviting them to help make these decisions from the very beginning. And I believe that's where real value lies. Susie, do you have anything you would like to add on to this?
No, that's exactly it. And the other thing too with community advisor groups is that it's really important to continue keeping dialogue between the community that's involved, so the members, and also the community outside of the members that are actually within that advisory group. So if they're representing, for example, rare conditions, ensuring that that gets fed back to the rare community, and also vice versa. So in terms of whatever's coming from the community to feed that back to the researchers or whichever organisation or system this is a community advisory group for. Yep.
Just like I mentioned, there are different ways in which you can engage with with community. I think Susie, if you wouldn't mind running us through quickly through the different ways in which we can engage with community.
Yeah, sure. So I've just listed some of the key types of engagement that you can have or that I've come across. And one of those would be a focus group, and that is where community members, limited to a smaller group, help explore shared and different experiences through the guided discussion facilitated by the researchers or whichever entity the organised the focus group. There are also workshops or forums which tend to be one-off consultations with community, and this is again where they might discuss or test, prioritise or shape ideas together for a project. Working groups, again, very similar to forums and workshops, but they may have smaller groups that might meet not more than once, so a couple of times over time, to help community members and project teams to review a task, wording, refining. So again, it's very short, small snippets of interactions, whereas community advisory groups tend to be on board for longer. So it could be for the lifetime of the project, or it could be for a section of that project. But the key thing there is that with CAGs, you have, generally speaking, the same members, I guess, contracted to contribute to this project throughout an ongoing period of time. But the key difference is that how much the influence the community members have, and how long they're involved, and whether their input has a clear pathway into decisions, changes, or outcomes. That's the most important thing to remember with however community members are engaged with research.
And yeah, like I mentioned, there isn't a perfect way of communicating with the community, but then community advisory group essentially helps us ensure that the voices of the community are involved from the very beginning of the project. Now, the second important question, which we would, probably receive, is why are we spending so much of time and energy into establishing a community advisory group? Why do community advisory groups matter? Essentially, because communities know things that organizations simply cannot know on their own. As a project team, we bring in technical expertise, we have research skills, professional expertise, but community members bring in something equally valuable. They understand how it feels like to navigate services. They have firsthand experience knowing what barriers people experience. They know what works in their community. And just as importantly, they also know what absolutely does not work in their community. So, community advisory groups help organizations make better decisions because they challenge assumptions. They improve accessibility because they identify barriers which may have never been noticed by organizations. They also help ensure that the project reflects community priorities rather than organizational priorities, or priorities which the organizations assume are important for the community. And perhaps most importantly, they help build trust with these communities. One quote that I've heard often being used in community engagement, and one I think actually captures the purpose of a community advisory group, is nothing about us without us. So if you're designing something that reflects communities, then communities should be involved in shaping it. They shouldn't be involved just at the end. They should be involved right from the beginning. Anything else you would like to add, Susie?
Sorry, I just got interrupted just then. Was the other important thing about the CAGs is that, again, it's the fact that they do have an equal say or a partnership with the group that they're engaging with. So it's a shared learning space as well, or at least I feel that a great space for a community advisory group that is successful is that they're treated as equal partners, and that they're able to contribute in ways that they feel comfortable with, and truly feel valued in that space.
Perfect. All right. Now, if we go into...
So I just realized that some of the text is
Oh,
glitched.
sorry about that. I think there's been a bit of an issue, but then it's fine. I'll just talk through the slide.
Out.
Yeah, technology. Now, when we talk about what makes a successful community advisory group, I guess there isn't anything set in stone on if you do this, you will get a successful community advisory group. But I think most organizations mostly focus on logistics. For example, how many members should we have? How often should we meet as a group? How do we need a terms of reference? Those things are important, but they're not what exactly makes a community advisory group successful or engaging or attractive. At the center of every successful community advisory group is meaningful participation. Everything else around it supports that. And just like we can see in this diagram as well, the core of a successful community advisory group is meaningful participation. And the first way you can achieve meaningful participation is by ensuring you have a clear purpose so that members understand why they're there, what are they representing, or what influence do they have in the project. You need to build trust with people so people feel comfortable sharing honest feedback. You don't want people to join your community advisory group just because you want representation. You want to gain important, valuable information from the community. And the easiest way to do that is actually spending some time building trust with the community. Good communication is very important to ensure that everyone in the group stays informed of the progress of the project, making sure that they know what is happening with the project. Another important thing is accessibility, making sure that everyone can equally participate fully. And it's not just about the physical accessibility part, and the easiest way to understand how you can make your meetings more accessible is actually by asking your community members, spending a bit of time getting to know them on a one-on-one basis, asking them if they have any accessibility requirements. Even the smallest things can make a huge difference and impact in the members' lives. And also making sure you respect different perspectives. That's the whole purpose of having a community advisory group, is to get different perspectives into your project, but also making sure that interactions are done in a respectful manner where you acknowledge different perspectives, and also making sure you moderate everything so that everyone feels safe contributing their ideas is very important in a community advisory group setting. And also making sure your community advisory group is flexible. Life happens, priorities change, different things happen in people's lives. So making sure your group is flexible so that there is an opportunity of contributing, not just by attending meetings, but in other ways, either by sending an email, or sending out a drawing, for example, if people are more comfortable, rather than listing out words, or any other ways in which they are comfortable sharing feedback. And also making sure you constantly ask members for feedback, and making sure you follow up on the feedback so that the feedback loop is closed and people feel like their contribution is valuable and valid, is a very important way in which you can make your community advisory group members feel extremely valued. And genuine shared decision making, because if people don't feel like their voices are influencing change, then eventually they're going to stop participating. So while the governance is important, relationships that you build with your community advisory group is extremely important in making sure that you have a successful advisory group. And I think that's one of the biggest lessons that I've personally learned from establishing a CAG.
Yeah, exactly. And I just realized as well, we didn't define what a terms of reference is. So for those that haven't been part of a CAG before or haven't seen this phrase, A terms of reference is a document that explains what the group is for and how it will work. So for a CAG, for example, it will set out the purpose of the CAG, what the members will be asked to do, what they can influence and what they can't, what sits outside the CAG's role, how the meetings will run, and how decisions or advice will be handled. There's also information around confidentiality and respectful participation expectations, and the details of how payment or recognition of reimbursement will be handled, and also a feedback loop of how the CAG can provide feedback or have any communications outside of CAG-specific activities. So the terms of reference is pretty much the group's shared agreement, and they help everyone understand why the CAG exists, what members can influence, and what is expected out of the project team, and how that group will work together. I'm not sure when I'm only recently new to this world of having community advisory groups and being involved in them, but I think with a couple of CAGs that I've been a part of as a participant or as a member, um, generally speaking, I noted that the terms of reference has already been formulated, for example, by research groups. And so it's there, you look at it, you read it, you decide if you want to be a part of it, and then you sign on. And something that we've changed even with the two CAG groups that we've established is that we've done the draft initially of the terms of reference, but then once we have selected and onboarded those members, we told them that that wasn't the finalized version of the terms of reference. We wanted them to actually provide their feedback so that it suited them. And then we signed that as a collective. So each member signed the agreed upon revised terms of reference. And that is a document that we revisit as often as we need to. And if we do need to update it, then we update it and we re-sign everyone up. And that's again just to ensure that everyone is aware of again the purpose, the expectations, and how we will be reimbursing or supporting the CAG members.
Oh, thank you for that, Susie. And since you mentioned the terms of reference, we will be sending through a copy of a sample terms of reference as well at the end with a couple of other resources which you might find useful if you're thinking of setting up your own consumer advisory group. So yeah, a sample TOR, sample position description, and a couple of other important resources as well. Okay, now before we move on to the next session, I'd like to pause here and get everyone to think a little bit more practically. Imagine your organization has decided to establish a community advisory group tomorrow. Now, where would you begin? Your organization wants to establish a community advisory group. Where would you start? A couple of options. Would you start by recruiting members? Would you start by drafting your terms of reference? Susie just explained what the terms of reference means. Would you define the purpose of your project and the consumer advisory group, or would you schedule the first meeting? Feel free to pop in a couple of answers in the chat or just unmute, and then, we can have like a little discussion where you can let us know why you think the way you think, essentially. So yeah, we're just going to give you a couple of seconds, think it through, and we can have like a little discussion. All right, we're getting a couple of answers here. A lot of C's. Terms of reference. That's different. Any other options, answers? All right. So it's actually defining the purpose of your project. And I think a lot of people already, mentioned that in the chat. I think all the answers that were mentioned are really logical answers. You can look at this in different ways. You can start by, setting up a purpose or establishing the TORs. You can look at it in multiple ways. But I think when we started our projects, we would have probably answered B or A or, anything as well. But then over time, we realized the most important starting point is actually C, which is defining the purpose of the project. Because if you don't know why your community advisory group exists, it's really difficult to make decisions about anything else. How will you recruit members if you don't know what kind of perspectives you need? How do you write terms of reference if you don't know what decisions the group will influence? How often the group should meet? What are the members essentially being asked to do? Everything flows clearly if you have a clear purpose for the project as well as the CAG. Once that's clear, everything else becomes much, much more easier. And that's exactly what I think both of our projects kind of discovered. Although our tags were created for very different reasons, we both spend a lot of time asking ourselves one very simple question: why does this group need to exist? And I think the answer to that question basically became the foundation for everything that followed. Okay, now I'd actually like to hand over to Susie, who's going to share her experience establishing the LINEAGE-GuaRD Community Advisory Group. But before Susie begins, I would encourage everyone to think about your own organization as she goes through her project. What similarities do you notice? What challenges sound familiar? And most importantly, what ideas could you adapt to your own work? Again, feel free to drop in any question throughout Susie's presentation, and we'll make sure to come back to them during our discussion. All over to you, Susie.
Thank you. Hello, everyone. I'm Susie, and I'm the lead on the LINEAGE study, which is it's a cross-institutional large study looking at the how genomic data can be collected, used, stored, and shared ethically in Australia. So developing a governance framework for genomic data in Australia. So initially, for this project, the GuaRD Collaborative, which includes SWAN, GSNV, and GAA, were involved in this project from the get-go. And I joined that group after, I think it was the second year it's been running. So it's a 5-year MRFF project. And at that point, we had the opportunity to develop a community advisory group, because what we noticed was that it's great that the 3 groups were there to represent community perspectives, or the rare community, or the GuaRD community, but it would be really, really amazing if we could actually get firsthand from community members themselves what they thought of this project or this study. And so we ended up having the opportunity to bring patient community perspectives into the project, so that the members could bring varied lived experience, whether they had genomics experience or any experience at all in healthcare, navigating healthcare, and also with varied levels of genomics knowledge. So whether they had any understanding of science, genomics, data, governance. I'm brand new to governance and all the legal jargon, so it was really interesting to hear different people from different streams speak in this project. And so the goal of establishing this CAG was not the technical expertise, but actually to bring in those diverse perspectives that could challenge but also strengthen the study. So one of the first steps that we had was that we drafted the terms of reference as a starting point with the CAG members, but we finalised them with the CAG so that the document reflected both the project's needs and also the members' expectations. And so one of the expectations that we had was that the CAG meetings themselves would create a direct space for community members to help shape the work with the researchers or with the investigators. So how we supported that, we created the conditions for meaningful contribution by, I already said, drafting the terms of reference, but also to build a public survey, which is a brand new co-produced project that looked at the public perspectives of governance of genomic data in Australia. So this survey was built with the community members and from the ground up. So we had a rough idea of what what we would like to look at, and then we asked the community members the CAG members what they found was important to them, what they would love to learn more about, and what they wanted to ask if they had the opportunity to ask the Australian population what their perspectives were or what mattered to them and where their values aligned. So we explained concepts without expecting the members to arrive as experts. And so we did ask them to have to let us know if there's something that isn't clear to them, and we obviously changed our ways until we could have very clear two-directional conversations. And we also offered multiple ways to contribute, and that included online meetings. We had chat options, texting, email. We also had an anonymous feedback portal in case someone didn't feel comfortable raising concerns in meetings or directly to us, which interestingly enough, no one has actually taken up yet. But we offered multiple ways for people to dial in or to join or to contribute. So some people weren't able to have their cameras on for personal reasons. We did have a lot of members from the rare community that were active. So we had one member that was doing a blood transfusion while attending a CAG meeting. We had another one that had kids there. I myself as well had my kids on a couple of CAG meetings. So we had to be adaptive, but also respectful of the needs of our CAG members. So we did have in our terms of reference outlined the dates way ahead of schedule for a whole year, to say these are the dates that we would hold the meetings, these are the times, so we could help them organise their days for those days where they'll be working with us. And we also, if someone wasn't able to attend a meeting and they gave us enough notice, we would ensure that they'd be able to catch up, whether that was reviewing the recording or having that space afterwards for them to review the minutes and then provide their feedback and continue moving on. So it's been great to have that space where we could give the CAG a framework, but not the finished answer. And also for the survey that we designed with the CAG, we had broader ideas that we wanted to explore, but the CAG members themselves identified the values, the questions, and even the wording that mattered. So we did try to make different ways how they can contribute in developing the survey, but also in influencing the broader lineage study itself. I think so. Slide 3. So I've got two screens as I had a different had a different presentation. But what helped so much there. Thank you. What helped the CAG become meaningful, engaging, influential in this project? So some of the things that the CAG members themselves identified when we were reflecting on our activities was that these things helped of having a clear purpose and the expectations. The meetings were well planned in advance. We reduced the cognitive load by pre-filling the forms as much as possible. So, for example, the reimbursement forms were able to fill out all their banking details, the amount, the comments. So all they needed to do was review it, sign it, date it, and send it back to us. And even downstream, I then would try to streamline that so that I could send that to my manager and have her sign it rather than having individual PDFs that she had to sign separately. We had regular check-ins and safe spaces for questions. And again, as I said, we had multiple ways that they could provide that conversation or that space for feedback. And we also, even though we didn't officially have a plan in place for how we would navigate disagreements, we did facilitate discussions. So if there were any agreements or points that we couldn't move on from, we would ensure that everyone was aware that this is a point that we couldn't address in the meeting time that we have. So we would then follow that up however was relevant. So it was really important to also acknowledge that because we're coming from diverse perspectives, different backgrounds, we're not going to agree, and we don't want everyone to be able to agree straight away, because that kind of defeats the purpose of having a diverse group representing the community. So the other thing too is that we protected the members from burnout while also offering growth opportunities. So when I say that, it was for those that already had a lot on their plates in terms of, obviously with rare conditions, we have a lot of carer duties and also our own self-management. It's really difficult to expect people to come to a meeting and be there the whole time. And we did find a couple of times that there were people there that would love to be part of this CAG and really, really enjoyed contributing, but it was in the end at the detriment of their own time and health. And so we needed to navigate that conversation of, is this really important to you? Is this the right choice? Can we facilitate, can we help you at all in any way? But there were some times where we did need to let go of some CAG members because it ended up being too much for them, and that was fine. And so we made sure that when CAG members joined our group, yes, we did contract them to be there for X amount of meetings or be there for a year, for example, but we always gave them the out. So they weren't upheld, they didn't have to come and participate. They could step back if they needed to, or if their needs change, that maybe they want to participate but not attend meetings. We try to be flexible as best as possible so that they could still contribute in a meaningful manner, but maybe not in the way that we had agreed at the very beginning. So that's again what I was saying with the terms of reference does need to be flexible, so that you can actually continue supporting your CAG members while also sticking to your project. What else was there? I think, so this is just a quick picture scope of the LINEAGE study. This is a poster in the middle that the CAG members had produced together. And at the very top there, you can see the Zoom window of the CAG meeting that we had. And so this is, I'm happy to share the poster afterwards, so I don't expect anyone to be able to see the text, but it's a poster that went to a conference, and we have Maya there, who was one of our CAG members and is also part of SWAN, co-present this poster with me. And it was so amazing to be able to be one, maybe two out of, I don't know how many posters were there that was actually being presented by the CAG members, not by the researchers, not by the head of research. It was actually the community members being involved. And this was a very pivotal moment at this conference, because I think it was one of the first times where community members were also given space to be present, present posters, but also to deliver workshops and deliver presentations, oral presentations. And one of the key messages that came through from that particular conference was that the researchers that attended this conference and the industry and the various stakeholders in healthcare, they loved the fact that they could hear firsthand what the impact is and what matters to the community members. And they wanted to hear more. They wanted to really hear how they could support this community. And so it was great to have that opportunity to finally bring community members to conferences, to places where you would not hear the actual community members themselves. You'd actually hear people representing the community. And so this poster was actually about, we thought that we'd have the survey done and dusted and ready to launch, but unfortunately we were still far away from even being able to get the ethics application in for the survey. So we ended up reframing this as, okay, what is this CAG meant to LINEAGE? What is it meant to the CAG members themselves? And some of the feedback, which is the green section in that poster, is how some had no idea about how science was navigated or how healthcare was navigated. They had no idea that this is what genomic data actually was, and they started to think again a bit more critically about what they agree to when they go to the doctors and say yes to a test or no to a test. What does that actually mean? And they really enjoyed seeing the different perspectives of various stakeholders, so legal people, ethics people, social scientists. I can't remember the term for that, but it was a great place where they could actually communicate with different people that are involved in genomic healthcare. And the section in the blue there is from LINEAGE investigators that had come to a CAG meeting and presented a topic and the impact it had on them. So this was one of those, and it's funny that this workshop is called Impact, because this is one of those rare opportunities where we had all the stars align and have the opportunity for the CAG members to learn and really contribute in different manners, whether it's posters, academic papers, presentations, or, the CAG members had learnt so much, but also the researchers themselves or the investigators themselves had learnt so much and were so grateful for that opportunity to interact with them. I'm going to wrap it up there just for time, but it's one of those things one of the things that we've learned along this pathway with this CAG is that it is so important to be that flexible, but it is also very important to, maintain your boundaries and your timelines. One of the things that we found challenging was that, yes, there are lots of diverse perspectives and we did work amazingly well together to create this survey, but we just continued to tweak it and tweak it and tweak it. And a year later, we still hadn't submitted the ethics and we still haven't launched the survey. So we've finally just now been able to put the foot down and say, okay, we're done with it. We're happy. We've submitted to ethics and it's hopefully going through very shortly, fingers crossed. But definitely make sure that you keep to your timelines and be very clear and specific on how everyone's interacting.
Amazing. Thank you, Susie. And I think definitely the word for the day is impact. We do keep talking about it a lot. Uh, but yeah, I think also, while you were talking, I realized although, consumer advisory groups might be different, the core or the essence of the group is essentially the same. The principles are remarkably similar. So whether you're working in research, healthcare, community engagement, building trust, creating clear expectations, and genuinely valuing lived experience are extremely important while you set up this consumer advisory group. And just to follow that up, I would like to share the experience of developing a consumer advisory group for, mapping the journey, a culturally safe navigation project, which has a slightly different focus, but many of the same underlying principles. Um, so to give you a bit of context, we have recently established a consumer advisory group for another project which the GSNV is involved with and leading, which is the Mapping the Journey, a culturally safe navigation project. So the project essentially aims to better understand and improve how the Filipino and the Vietnamese community navigate genetic and rare disease services. When we first started planning this project, we recognized something very early on. We wanted to create resources for the community and we wanted to do it with them, and we just didn't want to create something for them. Um, so, the easiest way to do that, which we felt, was by establishing a community advisory group. Because if you want to understand the experience, the barriers, the priorities of community members, they need to be involved in the project from the beginning. And we didn't want to simply ask them for feedback once everything had already been developed. Which is why establishing the CAG became one of the first priorities for the project. Now, to talk a bit more about the project has two key deliverables, which we will develop at the end of the project. The first one is to develop a cultural patient journey map. The aim of this map is to capture the lived experience of multicultural communities as they move through diagnosis and care. So this will acknowledge their lived experience. It will give healthcare professionals a better understanding of some of the cultural influence that community members have that influence their decision making, the impact of language, family dynamics, and health literacy. All these, how they influence their decision making ability essentially. And the second deliverable is a system navigation map, which is designed for the community. And it is designed to help them understand and to gain a more clear, more accessible guide to navigate the healthcare system. This is essentially for multicultural patients and families who are trying to access genetic services. So one thing that we were very very careful about, and we really prioritized, was to ensure that these resources are reflective of real experiences, and we didn't want to assume on what the consumers or the community needed. We wanted to ask them and develop resources based on their personal experience. And that's why we wanted our consumer advisory group to help shape the project from the beginning. And their role wasn't just to review the products at the end. We wanted them to get involved and help guide and steer the project from the very beginning. One of the questions which I think I regularly get is, how did we establish this CAG? What were some of the things that I considered when we were establishing the CAG? And where did we actually start? Interestingly, recruitment was not the first step. I think, like we mentioned a couple of times already, we actually began by carefully considering what kind of a consumer advisory group we actually wanted to create. So based on that purpose, we developed a position description. So anyone who was interested in the project understood what the purpose of this project was. They also could understand better on what their role would look like in this consumer advisory group, how much of time commitment would be required, what kind of reimbursement would be available, what the end deliverables would look like, so that they knew exactly what they were, applying for, and what the end of the project would look like as well. So after the position description was developed, we started creating an expression of interest process that allowed people to tell us more about themselves and their experience. So after that, we also developed a selection criteria list, so that we have diverse perspectives that shape the project, and we could learn more about what a value they would bring to this project as well. So now, after this, we started the recruitment project process, which was undertaken not just through general advertising. We went to community organizations and other trusted networks, as well as our GSNV network, to make sure we reach different people from different communities. Our focus was on the Filipino and Vietnamese community, as well as people who had experience in research, who had lived experience, so that different perspectives shape the project. So once the members were selected, we then started focusing on ensuring the meetings were accessible. We prepared materials in advance and made sure that people were comfortable before they attended the first meeting. And one way we did this was by establishing one-on-one meeting with all the people who were selected for our community advisory group. This essentially helped me create a personal relationship with each member. It also gave me a chance to talk to them on their accessibility needs, made me more aware of what their expectations were from the CAG. And essentially, we could set up the first meeting in a way that made sense not just for the project, but that made sense for the community members as well. One thing I would emphasize is that building a community advisory group isn't just about recruiting members. It is about creating conditions for people to participate meaningfully. And the best way to do this is just by asking members on what they would like to be included in the meeting. Um, Now, when I talk a bit about our first CAG meeting, the biggest priority for us was ensuring that the project was culturally safe, and the CAG had a focus on creating culturally safe participation. It was one of the biggest priority for us, and it still remains to be one of the biggest priority for us throughout the project. So when people usually hear the word accessibility, they often think about a physical accessibility process or, technologically accessible process. Those things are important. I'm not saying they're not, but cultural safety is just as important. So we wanted to make sure that members feel respected, valued, and also they feel very comfortable contributing to the discussion and sharing their experience. And what that meant was carefully thinking about how we facilitate this discussion. So, one of the ways we did that was by ensuring that we used plain language instead of using technical jargons or scientifically heavy, rich language. We also made sure we acknowledged different cultural backgrounds and experiences that were brought towards the group. We also created a psychologically safe environment so people felt comfortable disagreeing or sharing different perspectives. And I also think it really helped us that the lineage CAG was established before, because I got to learn a lot from Susie's CAG as well. I had regular meetings with Susie, and a lot of the things that worked in their CAG was incorporated in ours as well. And one of the ways that we created a safe environment was using the anonymous feedback form that Susie just talked about. And that was actually really successful in our CAG, because there were a couple of things members were not comfortable discussing as a group or sending an email to me personally about, because they didn't want to disclose their identity. So we did include an anonymous feedback form, which a few of the members used, and they kind of shared some of the things that made them uncomfortable, some of the discussion points that they felt could have gone better. And we not only did we get the feedback, but we did make sure that we came up with solutions so that feedback loop was closed, and the members feel valued, that their perspectives were considered. And another important thing that was a priority for us was providing reimbursement. So participation felt valued. We wanted to make sure that their time and their expertise was considered, and we wanted them to feel valued in sharing their responses. And recognizing that meaningful participation sometimes means giving people extra time to think, reflect, and contribute in different ways was very important for us. And I think, just like Susie said as well, it wasn't just, contributing during the meeting, giving all the members an opportunity to contribute outside, whether it was in the form of email or whether they wanted to set up a one-on-one discussion with me, or even through the anonymous feedback form. A lot of them said that they were comfortable sharing ideas in different ways. They wanted to share a drawing or send resources through, which again was very important and helpful for us while we were thinking of setting up the focus group which would follow. So I think the aim of the CAG was pretty simple for us. We wanted everyone to feel comfortable speaking, not just because they were asked to, but because they genuinely felt like their voices mattered. Um, and yeah, based on the first CAG session, we got a lot of different insights from the members. Although we've had only a couple of meetings, we've already learned a lot from our group. One of the strongest messages that was conveyed through the CAG was that the following focus groups shouldn't feel like a transactional approach. It should feel very conversational. They did mention that people are more likely to share openly and discuss their personal experience if they feel relaxed and respected, rather than if it's an overly structured meeting. They also suggested that, since we talk about complex conditions, very personal experience, it would be better if we have a general focus group, but then again have a one-on-one discussion where they could share some of their personal information in a more private setting. So as a result, we already started redefining the facilitation approach for the upcoming focus groups. Another important insight was around communication. The community members reminded us that the resources that we share should not have a lot of technical jargon and scientific language. So we decided to make sure that the resources we develop are all written in plain language and would be extremely easy to understand. Include a lot of infographics using the universal concepts of accessible resource development. Um, and we also, the next important point that was brought out during our CAG sessions was that the members wanted to stay informed throughout the process. They didn't just want to attend meetings. So one of the things that we are carefully considering is the commitment on providing regular updates in between meetings, not just during meetings, and making sure that members understand how their feedback is influencing this decision. So I think one of the biggest lessons that I've gained from this from the CAG has been people just don't want their opinions to be heard. They want to know that their opinions are making a difference. So again, like I mentioned, closing that feedback loop is very important. And it's an extremely important part of meaningful engagement. I think we talked about two different projects, two different communities, but there were a lot of similar lessons, a lot of shared learnings. Um, we're coming to the end of our session, and we would like to talk a bit about top 10 tips which we have for establishing a CAG. Again, there aren't there aren't any set rules that you have to follow while establishing a CAG, but I think these are a couple that worked for both of us. So Susie, do you want to go through this?
No, I was actually going to say I need to head off to the next meeting, but
Ah,
we will definitely. So in the chat, thank you so much for attending, everyone, and also, yes, we will send a copy of this this workshop and this meeting and all the resources and links that we have to everyone that attended.
all good. Okay. I am aware that we are at the end of our time session, but then I'll just go through this really, really quickly. So some of the things that we feel like would be important or to consider while you establish a CAG is, again, starting with a clear purpose, being able to answer why the group exists is really important before you start recruiting members. Making sure you recruit diverse voices, different perspectives lead to better discussion and stronger outcomes. But it's also important that you moderate these discussions because stronger outcomes might result in discussions going on for a longer period of time. So having that moderation where you feel like this is what the purpose of our project is, making sure that you don't steer away from that conversation, bringing different perspectives, but then staying true to the core of your project is really important. Building trust and relationship before the meetings. Like I said, maybe having a one-on-one session before you have your CAG session with each of the members will help you understand a bit more about their requirements, needs, and what they expect from the CAG and the project. Building a framework, establishing the terms of references, but then letting members shape it is really valuable. I think it's important that you bring ideas, not finished decisions, and let members shape it. Um, Another important point is being transparent about expectations. Again, letting people know about what the commitment would look like, what their contributions would look like in the future, what kind of reimbursement is available, how much of external time commitment apart from the meeting would be required, being extremely transparent so that, members have an idea of what, contributing the project would look like. Another important point is creating a culturally safe space. Being inclusive is much more than just being representative. It is about ensuring that everyone feels comfortable contributing. and making sure that the participation is accessible. Think about language, timing, technology, and different communication preferences that members might have. And also making sure that you follow up consistently with the members, making sure that their contribution is valid, they're valuable, and you're actually using feedback to, shape your projects. And finally, the most important thing is closing that feedback loop, making time to tell people what changes were brought about based on their input. And I think all of this ultimately leads to building trust, because I want you all to remember that trust takes time. It's not something that will start from the beginning of the CAG, but then you can't rush relationships. But then if you consistently put in an effort and build a trustworthy relationship with your CAG members, you will definitely end up getting a lot more value from your CAG. All right, then, that's all from us, but we would definitely like to hear from you about the challenges you experienced. What was your experience like, setting up a CAG? What has worked well for your organization? If anyone would like to share a couple of words, I think it would be really valuable for us as well.
I'll add something. My name's David Rowley. I've always found with any sort of support or volunteer group, not CAGs aside, it's hard enough to attract people in the first place, but then it is very hard to retain people. One of the things that hit a note with me was people's lives change, and there's different priorities, and once they get into the group, it may not be suitable for them. I like the approach of doing that one-on-one interview. Your terms of reference, that's something I'm going to look at for a CAG that I've volunteered for through NDIS. I don't think we really need it, but I think it's really good for new members. And it sort of made me think that, we need to go on a recruitment drive, because, we've probably halved members over the last couple of years. So 6 members is not a great number, but thank you very much for the presentation, Malavika and Susie.
Thank you so much, David. And I do agree. It's very important to acknowledge the people who are joining your CAG. They are putting in effort. So making sure that you are flexible, making sure you acknowledge that circumstances change. And again, like, there isn't a good number of members in a CAG. You might have 4 members, and you might still have a really successful CAG. But it's about the perspectives that they bring. You don't want people having the same kind of perspectives and just following through what you're saying. You want them to challenge you. You want them to, kind of, come up with different ideas from your own, so that you can think a bit as well, and then, come up with, better ideas for your project. So thank you. All right, then. We do have a few resources which we will be sharing. We will send you an email at the end of the session with a couple of additional resources. We will be including a sample TOR, which you can use or you can adapt if you are thinking of setting up your own CAG, as well as how to, set up safe spaces during facilitation process. We would also be sending in a survey link to talk about your experience during this session, if you have ideas for future impact sessions, because we do value your opinions as well. So thank you so much for joining our session today, and we look forward to seeing you during our next impact session. Thank you so much.